Hey, welcome friends to another Prescriber Spotlight. I'm Mike Collins from Healthway Compounding Pharmacy, and I'm very pleased to have Dr. Olivia Phifer-Combs with us today. How are you doing?
I'm doing well, thank you.
Good, good.
Thank you.
So, Dr. Phifer-Combs, tell me a little bit about what type of physician are you? What type of patients do you see?
So I am an ob-gyn physician in Saginaw, Michigan, and I'm a part of a private practice that is physician-owned. And we see various types of patients, especially women in their various phases of gynecological care, starting from adolescence to obstetrics, delivering babies, to various phases of going through menopause, and all those aspects of basically women's health.
Perfect. So talk about some of the other providers that are in your office. I know that you're not the only physician here.
Correct. There are 7 physicians at Valley ob-gyn. We also have 2 nurse midwives who are mainly based out of the hospital here in Saginaw, along with, we have 4 physician assistants along with nurse practitioners.
Awesome, awesome. So can you talk a little bit about the different kind of prescribers or providers, I guess is a better word to use. So what's the difference between the physicians and these other providers that you have here in the office?
Well, a lot of times our nurse practitioners and our midwives are the ones that mainly see our obstetrical patients. They also do postpartum visits as well, but they're also based out of the hospitals too. So we have 2 of our midwives that do 2 clinics here seeing our OB patients and then go to the hospital, and then our nurse practitioners and our PAs see all of our patients as well, do annual visits with women and also with obstetrics as well. And then the providers, obviously we see every woman in every various stages of their life. More with when patients are having concerns about things, they'll definitely come to see us.
I think a lot of times when we think about OB/GYN, we think about just pregnant women, but obviously you see a lot of different types of situations. What would your typical day or week be like as far as the types and variety of patients you would see other than just pregnant females?
Well, so each of us as the docs usually will have about 2.5 clinic days, and when we say clinic days, that's seeing various types of patients in the sense of adolescents with abnormal bleeding, needing birth control. We also see our OB patients, but then we get into more of the gynecological issues of abnormal uterine bleeding, women with menopausal type symptoms, also incontinence, which I know is something that's hard for some women to want to talk about. And so that is where it's our job to ask those questions and make sure we're getting every aspect of women's health to make sure they're getting concerns taken care of. So it's not always just OB. That's the fun part of ob-gyn, but that's the luxury of this field, is we get to basically take care of women in all these sorts of their life.
That sounds ideal.
Yeah.
So let's talk about some of the other kind of, I guess, female issues that you might see patients for, because that might set us up for some other videos to come in the future.
Definitely.
So tell us about some of the other things that patients might come to see you for.
I would say one of them, as far as from an obstetrical standpoint, after patients deliver, would definitely be with lactation. Some women are having kind of issues with lactation, and it's something that women are very passionate about, so see us after for that. As far as adolescent type care, our most common would be abnormal bleeding. And then also in our older population, definitely bleeding that changes along with going through the stage of menopause, hot flushes, night sweats. One that's a very common, especially in those menopausal years, is vulvar atrophy and painful intercourse. Those gets to be more common topics.
Perfect. Well, that sounds like some great topics for another discussion soon to be discussed. So I want to thank you for being with me today on our Prescriber Spotlight. Again, Mike Collins from Healthway Compounding Pharmacy. And so pay attention, and thank you again, Olivia, for being with us today.
You're welcome. Thank you.
Thanks.